had a baby in February, and I went in for a normal routine checkup, and I got a call a few weeks later saying my exam was abnormal. So I went in for a biopsy. About 4 days later, the doctor called back and wanted to see me in his office, so I knew it was not good news. And my husband and I went into the office, and he said I had cancer.
I always knew that she was probably going to be my wife and the mother of my kids, and I always knew she'd be a great mom. She's always just fantastic with people and just the kindest soul, and she's a tough girl too.
Therapists were ready.
I didn't really dwell on the why me because I had so many more important things in my life to think about. There's no point in being angry. It's okay to be angry, and it's okay to be sad, and it's okay to be depressed about it, but I don't let that take over my life.
You know, there's always that thought in the back of your mind, I guess, the worst of the worst, and I just kind of take it one day at a time, and knowing that eventually we'll get through it.
Oh no. Hey, Mr. Dickey.
Hello, good guys, how are you?
It takes a lot of support and encouragement to get patients through these long treatments and to really make them feel like they don't have the weight of the world on their shoulders, that they can basically come in here and we'll take care of the questions and concerns, and they can just kind of focus on living their life and just kind of putting one foot in front of the other.
We got 5 more to go?
Yeah.
I just wanted to see if you had any questions or concerns that I can help answer before you come for your appointment. We're here to make sure their questions are answered, and we're here for anything that they need, and that's something that we value. You know, being able to connect them with resources, whether they be resources in the community, such as transportation to appointments, or, you know, somebody to help them out, run errands, things like that, or connecting them with our support groups or our financial counselors here at the center. Just being able to address the whole variety of concerns that come up. I do think it gives them hope and confidence that they are going to be able to do the treatment and that they are going to be successful, and it makes things more manageable.
And I told her it's fine to make payments too.
Yeah.
We really try not to have the patient worry about whether or not this is going to be covered, or is this going to wipe out my retirement, or, you know, what is this going to do to me financially? And so we offer those payment plans that are comfortable, and we offer these programs that make sense and that they're excited to maybe have the chance to qualify for, and we manage it. It's our job to make sure that the patient seeks that care that's best for them, and then we fight to make it happen financially.
And I think it's worthwhile going back and looking at the treatment plan. There's a lot of different ways to approach cancer, and we really try to sit down with folks and figure out how to address their individual need. There are usually guidelines in terms of how we approach things, and that's based on clinical data to really support what the benefit of each treatment is. So if you have radiation, or you have chemotherapy, surgery, those are probably the big 3 ways to treat cancer.
I think one of the things that we do well in our facilities is trying to make sure that patients feel comfortable with the treatment. So many times patients are maybe afraid to ask questions, or they don't want to ask too many, and I don't think that our doctors feel like there's such a thing as too many questions. We want you to be well informed, and again to feel comfortable with what's going to happen and the plan to move forward.
Radiation therapy is the delivery of high-energy X-rays. They're used to target tumor cells and disturb their DNA. We have the ability to diagnose where that tumor was located. We have the knowledge of knowing where that tumor might travel to, and then we come up with a program.
We're going to use this every day when you have a treatment.
Prior to therapy, we do a CT simulation. Basically, the patient is in the position that they're going to be in when they're being treated.
I give them tattoos if they need, or make a thermoplastic mask if we're treating anywhere in the head or neck, or any other device that may be needed to make sure that their therapy is consistent and accurate through the whole treatment process.
They gave me little tattoos, and then they kind of GPS coordinate where they want the radiation specifically targeted so that it has the most impact on the area it needs to, and and less impact on your other organs and what it doesn't need to touch. The ladies that did my radiation were amazing and made you feel so comfortable. It's all painless, you don't feel anything at all. And I just laid down on a table and a little machine just circled around me while I laid there for a few minutes, and it was real easy, and then I went home.
Some people come in, get their treatment, they continue to work, they continue their exercise program, and they really don't feel any different.
Are you ready?
On the opposite end of that spectrum are people that just are weak and tired feeling and really not feeling well. Most people lie in the middle of that somewhere and have some element of fatigue.
Obviously, the skin problems that we talked about.
Everybody will have some sort of a skin reaction. Normally the skin reaction starts out very light, it looks like a little suntan, then it can become a little pink, and then it can become red. What we don't want to happen is for it to become blistered or weeping, and so that's why we see the patient on a weekly basis, to try to avoid those type of symptoms. So everybody has those. Otherwise, it's site-specific.
I need more help now, but I still can go to the grocery store. I can still clean up after the kids and do the dishes, and I still go on walks with the family, and my husband and I still go out to dinner and enjoy quiet time after the kids go to bed. It's more of an inconvenience at times. You just have to work around it and know that, in a few days or a week you'll be feeling better and you'll be back on top of things.
Our physicians are giving them the prescriptions that will do the best to kill their cancer, and we truly care about how they do with this process. We want to make it as easy on them as possible because it's such a life-changing event.
I hate that so many people get this, and it seems unfair sometimes, but we just know that they're doing the best thing for themselves and that they're going to get better.
Robin's a remarkable person. She has a bright spirit. She lifts everybody's hearts here. She has tremendous courage and will, and she truly is an inspiration to all of us.
What you're going through is going to be scary at times, but you are strong, and I know that you can do it. You'll get through this because it's a very small chapter in your life, and you have to be strong for yourself and your family, and you can do this, and you'll be okay.